Gentlemen, let me ask you something honestly, without embarrassment and without exaggeration. What if the reason your performance feels weaker, less reliable, or simply not the way it used to be has nothing to do with your age and everything to do with a small, neglected area of your body that almost no one ever talks about? What if there were a single spot, about the size of a coin, that plays a powerful role in blood flow, nerve signaling, sensitivity, and confidence? And what if giving that area just one focused minute of attention each day could help restore what you thought was permanently lost? I know that may sound surprising, maybe even uncomfortable at first, but stay with me because what you're about to hear is grounded in anatomy, circulation science, and decades of clinical observation, not gimmicks or false promises. Most men are told, directly or indirectly, that decline after 50 is inevitable. Slower response, weaker erections, reduced sensation, and fading desire are framed as normal signs of getting older. Many men accept this explanation quietly, even if it frustrates them deeply. They adjust expectations, avoid intimacy, or rely on medications that offer temporary help, but never truly address the root of the issue. Over time, this acceptance turns into resignation. But here is a critical truth that rarely gets explained clearly. Age itself is not the primary cause of declining potency. The real issue is what years of stress, sitting, tension, and reduced circulation do to the pelvic region and the nerves and blood vessels that support male sexual function. Inside your pelvis is a network of muscles, connective tissue, nerves, and blood vessels that work together to control erections, ejaculation, bladder function, and sensation. These structures are designed to be flexible, responsive, and well supplied with blood. But modern life works against this design. Long hours sitting, chronic stress, shallow breathing, poor posture, and lack of targeted movement cause the pelvic floor muscles to remain partially contracted for years at a time. When muscles stay tight, blood vessels passing through them become compressed, nerves lose sensitivity, oxygen delivery drops. Over time, this creates a situation where arousal signals from the brain struggle to reach their destination, and blood flow cannot respond efficiently even when desire is present. Think of it like an old garden hose that has been bent and kinked for years. The water source is still there, but the flow is restricted. You can turn the faucet on as hard as you want, but the hose simply can't deliver water the way it once did. This is what happens when pelvic tension and poor circulation go unaddressed. Pills may temporarily force blood through, but they do not remove the kink. They do not restore elasticity, nerve sensitivity, or muscular balance. That is why so many men find that medications become less effective over time or stop working altogether. The encouraging news is that the male body has an impressive capacity to recover when the underlying problem is addressed. By releasing tension, improving circulation, and reactivating nerve pathways in the pelvic region, many men experience improvements they believed were no longer possible. One of the most effective ways to begin this process involves a specific area that has been recognized for centuries in traditional medical systems and is now better understood through modern anatomy. This area is located in the perineum, the soft tissue between the scrotum and the anus, sometimes referred to in traditional practices as the $1,000,000 point. This region sits directly above critical pelvic floor muscles and near branches of the pudendal nerve, which plays a major role in erection strength, ejaculation, and sensation. It is also close to blood vessels that supply the penis and surrounding tissues. When this area is chronically tight or neglected, circulation and nerve signaling suffer. When it is gently stimulated and relaxed, blood flow improves, nerves become more responsive, and muscular coordination begins to normalize. This is not mystical thinking, it is a mechanical and neurological response rooted in how the body functions. Before explaining how gentle massage of this area can help, it's important to address the most common mistakes that silently sabotage male potency. The first and most damaging mistake is ignoring pelvic tension altogether. Most men are completely unaware that their pelvic floor is tight. They may feel tension in their shoulders or neck, but they do not recognize that the same stress response causes unconscious clenching in the pelvic muscles. Holding in urine, bracing during stress, sitting for long periods, and even emotional suppression contribute to this chronic contraction. Over time, tight muscles lose both strength and flexibility, creating weakness and reduced control rather than power. The second mistake is relying solely on quick fixes. Medications can be helpful tools when used appropriately, but they do not retrain muscles, restore nerve sensitivity, or improve vascular health long term. They act downstream, forcing a response without addressing why the response was impaired in the first place. This is why many men feel disappointed when the initial effectiveness fades. Without addressing circulation and tension, the underlying problem continues to progress. The third mistake, and perhaps the most harmful psychologically, is believing that decline is unavoidable. This belief quietly erodes motivation and confidence. Men stop paying attention to their bodies. They stop exploring solutions. They internalize the idea that their best years are behind them. In clinical practice, this mindset often causes more damage than physical changes themselves. When men learn that improvement is possible, even later in life, their bodies often respond more quickly than expected. Gentle stimulation of the perineal area works because it directly addresses these mistakes. It encourages relaxation of chronically tight muscles, increases local blood flow, and stimulates nerves that may have been underactive for years. Over time, this combination can improve erection quality, sensitivity, bladder control, and even pelvic stability. Some men also notice reduced lower back or hip discomfort because pelvic tension is closely connected to posture and movement. The technique itself is simple, but its effectiveness depends on consistency and gentleness rather than force. This is not about aggressive pressure or discomfort. The goal is to send a signal of safety and relaxation to the nervous system while encouraging circulation. Using clean hands and a natural oil to reduce friction, gentle pressure is applied to the soft area between the scrotum and anus. The sensation should feel firm but comfortable, similar to pressing on a muscle knot that slowly begins to release. If the area feels tender, that is often a sign of long-standing tension rather than injury. Slow, controlled movements work best. Some men prefer small circular motions, while others respond better to gentle pressing and releasing. The exact pattern is less important than maintaining awareness and avoiding strain. 1 minute is sufficient when done daily. Longer sessions are not necessary and do not necessarily produce better results. Consistency matters more than intensity because the body adapts gradually through repeated signals rather than sudden force. Natural oils can enhance the experience by reducing friction and supporting skin and tissue health. Oils such as coconut oil are gentle and well tolerated. Castor oil has traditionally been used to support circulation and reduce inflammation. Black seed oil has a long history in traditional medicine and is valued for its antioxidant properties. The oil itself is not magic, but the warmth and smoothness can help the body relax and accept the stimulation more easily. Warming the oil between the hands before application helps prevent the reflexive tightening that can occur with cold contact. Timing can also play a role. Some men find morning practice helpful because testosterone levels are naturally higher, and the nervous system is transitioning from rest to activity. Others prefer evening practice because it promotes relaxation and may improve sleep quality and nighttime erections. There is no single correct time. The best time is the one you can maintain consistently without rushing or stress. It is normal for some men to feel hesitant or awkward at first. Cultural conditioning has taught many men to disconnect from their bodies, especially areas associated with vulnerability. But there is nothing shameful or unnatural about caring for your pelvic health. This region plays a central role in quality of life, confidence, and vitality. Ignoring it does not make problems disappear. Gentle attention, on the other hand, often brings surprising benefits. In clinical settings, men who commit to simple daily practices like this often report changes beyond sexual performance. Improved bladder control, reduced pelvic discomfort, better posture, and increased body awareness are common. One man in his early 50s shared that after several weeks of consistent practice, he noticed not only stronger erections but also reduced hip pain and better control during exercise. These improvements are connected because the pelvis is a central hub linking the upper and lower body. It is important to approach this practice with realistic expectations. This is not an overnight transformation, and it is not a replacement for medical evaluation when serious conditions are present. However, as part of a holistic approach that includes movement, stress management, and healthy circulation, it can be a powerful tool. The body responds to signals it receives repeatedly. A single minute each day sends a message that this area matters, that circulation is welcome, and that tension can release. What matters most is the mindset with which you approach it. This is not about chasing youth or proving anything. It is about restoring function, comfort, and confidence in your own body. Aging does not mean surrendering vitality. It means adapting intelligently to what the body needs now. Small, consistent actions often produce the most sustainable results. If you take one thing away from this discussion, let it be this: you are not broken, and you are not beyond improvement. Many of the changes men experience later in life are not permanent losses, but reversible adaptations to years of neglect, stress, and misunderstanding. By addressing circulation and pelvic tension directly, you give your body the opportunity to function closer to its natural design. Commit to 1 minute a day, stay patient, pay attention to subtle changes rather than demanding immediate results. Over time, many men find that what returns is not just physical response, but a renewed sense of confidence and connection to their bodies. That confidence often carries into other areas of life, improving relationships, mood, and overall well-being. Your future self will thank you for the small decision you make today. Vitality is not reserved for the young. It is supported by those who continue to listen to their bodies, care for them, and refuse to accept decline as inevitable.